Hi there. How are you today? Happy Monday. Today, I want to talk about celiac and gluten sensitivity. And I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center, and the author of the book, Healing When It Seems Impossible 7 Keys to Defy the Odds. And I'm going to talk about gluten and celiac because I get a lot of questions about when I tell people to avoid gluten or to stay away from gluten. And so I want to clarify sensitivity versus celiac and even versus allergies and what all of those things together will mean for your health. So, for many of my clients, or for many of you, I recommend that you stay away from gluten. And sometimes I say stay away from all grains in order to reduce inflammation in your body. Celiac disease is a specific disease where you have a genetic problem where your body cannot do gluten. There's a gene called HLA. I forget what that means, but it is responsible, like about 50% of the population actually has this gene, but it does not mean that you have celiac if that is the case. It like 1 or to 3% of people actually develop celiac even if they have that gene. So, and the celiac is specific. So, uh, it'll cause diarrhea, a lot of gut issues. It'll cause, bloating and gas and poor absorption of nutrients. So, over time, a child who has celiac can have all these problems with their body that are related to not being able to tolerate gluten at all. They may have vitamin deficiencies, nutrient deficiencies of other sorts. They can have seizures and migraines and all kinds of symptoms that are not just gut related. Now, a person with gluten sensitivity could also have some of those symptoms. They can have gas and bloating and pain when they eat, but not only that, with gluten sensitivity, you could have migraines or depression. I have patients who didn't know that they had a gluten problem. And then one of my patients, actually, his wife got diagnosed with celiac, that she had and that was the cause of her migraines. And he said, well, I'll go off of gluten as well to support you. And so he did. And then, things go on and you don't notice anything. And he went out for pizza one night and he'd done that a few times. And his wife pointed out to him, did you notice that you got depressed whenever you ate gluten? And he hadn't noticed that. But then when she pointed it out, it was like, oh my goodness. So he realized that he couldn't eat gluten because it was causing depression. So gluten can cause a lot of different symptoms that you might not expect. And the big difference is really that with celiac, it's an autoimmune disease that can make you very, very ill and can damage tissue over time. Whereas with gluten sensitivity, it may not make you terribly ill over time, but it can also cause damage to some of your organs if you keep eating it when your body doesn't want you to. Now, a lot of people ask me, or a lot of people say, oh, yeah, I'm 90% away from gluten, but that's not enough. You have to stay 100%. Like if you're sensitive to gluten, you have to stay 100% away from it. It's not just something you can eat sometimes. Now, it's some people, uh, even people with celiac, may not have the symptoms right away. So there are certain things that could trigger the symptoms. You could have had a bad infection that suddenly causes your body to be sensitive to gluten or for the celiac to be triggered. You could have like a chronic stress, really bad stress, or a major trauma in your life could trigger your body to suddenly have a different behavior. Having had some kind of food poisoning can cause an inflammation in your gut that could then trigger either celiac or gluten sensitivity. So it may start, may not start until you're in your 50s or something, and that is okay. That is not an uncommon thing for people to notice. For some of my clients, when they go into menopause or when their hormones start to shift, that's another reason that you can develop gluten sensitivity at a later time in life. Also, there's some research that shows that exposure to glyphosate or certain pesticides, so foods that aren't organic, that have been sprayed with glyphosate or have been exposed to glyphosate, can trigger inflammation in your gut, which can then cause you to be sensitive to gluten. So that's another possible reason. For people who have gluten sensitivity, there is a hope that you can eventually actually heal your gut enough that you might be able to tolerate gluten again. So let's say that you go through a process of staying away from that food. I often say, like when you do an elimination diet is one way to test if you have gluten sensitivity. So with an elimination diet, what you would do is you would eliminate any food that could potentially be a cause of your symptoms. So, commonly, dairy, gluten, sugar, uh, sometimes for some people, other grains. So, I say when you do an elimination diet that you should stay away from all grains and all dairy, and then do that for 3 weeks because that's usually enough time for the inflammation to cool down. And then after you have done the elimination for a period of time, then you add in one thing at a time and test to see how you feel. And how you add in one thing at a time is you take, let's say gluten is the thing that you want to add first. So you've done 3 weeks, you feel better, and then you try gluten. And you're going to try it at breakfast, lunch, and dinner. You're going to try it several times in the day, and then you're going to see how you feel. Not just that night, but the next day too. You're going to wait and see how you feel the next day. And if you feel worse, then you know that you've reacted to that food. So then you cut it out and you eliminate again for a couple of days, and then you add in another thing. And you just do that. You add one thing at a time and you wait, like you try it several times in the course of a day and then see what happens to your body. And it's I call that reducing the noise. Elimination diet kind of reduces the noise so that when uh, your body doesn't have all that action going on, all that inflammation from all the foods that it might be not tolerating, and then you can try again to see, what does it, what is the problem here and how is it affecting me. So another thing is with celiac, you really can never eat gluten because it is a genetic problem that your body cannot tolerate it. And especially, I have a few patients actually, so that this is something that's not commonly known and is not common commonly discussed is one, seizures, and two, migraines. Seizures, I've had 3 patients who had severe seizures at different ages. There was some that were in their 30s when they started having seizures, one that was, and a couple that were in their teens when they started having seizures. And nobody really knew why, but then found out that they had celiac. And when they stopped eating gluten, they stopped having seizures. And any amount of gluten, like even a little bit of flour contaminating a cutting board, could cause that person to have a seizure. So it is really a big deal being careful with gluten. And for certain people, it's it's not life or death that you're not going to die, but a seizure is a significant problem, right? And migraines too. A lot of patients actually who have migraines are either sensitive to gluten or dairy, and just cutting those foods out completely will help with that. So those are the things that I wanted to talk about. And again, the most important point really is if you have a sensitivity to any food, no amount of that food is going to be okay. No amount of taking it is going to be okay. I have another client who was born allergic to eggs, and no amount of eggs is going to ever be okay for her. And even a little bit of egg in a like a cake or a pastry or something is it can cause her to have hives and an anaphylactic response where she can get short of breath, and she needs to have an EpiPen around just in case there's an egg exposure for her. So happy Monday. And if you have any questions, post them in the comments and I'm happy to answer them. Have a wonderful day. Thank you.